To some people, they consider their hair as their best asset. But to those who are suffering from hair loss, this is not the case. Instead of being a source of pride and confidence, this very condition serves as a factor that lowers their self-confidence. Contrary to common belief, age alone does not cause the hair to fall. In fact, more and more experts agree that there are more particular factors that cause hair loss both in women and men regardless of age, race, and status in life. Studies show that it is healthy for people to lose at least 100 strands of their hair every day. This is because this very phenomenon is a normal part of the hair growth cycle. Usually, the strands of hair that fell are replaced with a new set of hair strands in less than 16 weeks or 4 months. However, people who experience more amount of hair loss on a daily basis should consider seeking medical advice. Visiting the doctor about this is very important not only to find out what causes it but also to ensure that there is no related complication along with the excessive hair loss. Risk factors of hair loss. Experts say that almost all people are prone to losing their hair, especially if they don't pay attention to the risk factors involved. It is said that the primary cause of hair loss can be traced to heredity. People whose parents have baldness genes are said to have the strongest risk factor. Hair loss for these people is quite inevitable since nothing can be done when it comes to their genes. The thinning of hair and receding hairlines usually manifest once one ages. Aside from heredity, people who are suffering from terminal illnesses such as cancer and autoimmune diseases such as those related with thyroid also have greater risks for hair loss because the disease themselves weaken the immune system and affect hair growth. Taking in medications and medical treatment for certain illnesses and conditions also increases the risk to hair loss as well as alopecia areata, which may cause permanent baldness brought about by stress as well as other infections in the environment. People who do not pay attention to proper nutrition also have higher risks for hair loss, especially those who are low in protein intake. Women who are pregnant may also experience temporary hair loss since the nutrition in their bodies is shared with the growing fetus inside. Those who are taking in birth control pills also experience this condition because of the hormonal changes that take place in the body. People who change hairstyles often and those who use too much hair treatments may also undergo temporary hair loss. The needed medical attention. A person who has at least 3 risk factors of hair loss should seek medical advice immediately to prevent further complications. When you go to the doctor, make sure that you point out all your concerns so he or she can make the right diagnosis and recommend possible treatment option for you. The doctor will run some tests to find out what causes your excessive hair loss. Once all the tests have been made, she or he will then explain your condition and will try to give you medication or offer you treatments for temporary hair loss. Since no treatment can cure permanent hair loss such as those caused by heredity and medical conditions, the doctor can give you options to at least slow down the rate of hair loss.